Thanks for joining us this morning. If you don't know me, my name's Charlotte Wilson and I'm the Service Manager for Children and Young People with the Care Inspectorate. This morning's webinar is on Key Question 7 for mainstream boarding schools and school hostels, so hopefully that's what you're all here for. So during this session, we'll be sharing the findings of the Key Question 7 review, as well as the updates that we've made to the document. And we'll be providing some information on our new self-evaluation toolkits for our services as well. Your cameras and mics should be disabled, and just to make you aware, we're recording this session so that anyone who's not able to join us this morning can watch it back afterwards. If you've got any questions, please just use the chat function and we'll try and respond to them today. If not, we'll get back to you obviously following the session. So just to introduce our speakers this morning, we've got Anthony from our methodology team who'll be sharing the findings of the Key Question 7 consultation. Then we'll be hearing from Mary, one of our team managers, who'll be taking you through the changes to the Key Question 7 document from the old version. Then we'll be going back to Anthony for some input on the new self-evaluation toolkits. And we'll be hearing from Lauren, who's one of our inspectors, on a participation project that she's running before we move into a question and answer session. Just to flag as well, I'm aware this session's in your diary for an hour and a half, but it's quite a small group this morning, so we might be finished a little quicker than that. But hopefully nobody minds if we finish a bit earlier and you get some time back in your day. So to start off with, I'm going to hand over to Anthony for the first input this morning.
Thanks, Charlotte. Just let me get my screen ready, please, folks, and then we'll be good to go. So yeah, good morning. I'm conscious I may be familiar to some of you if you've contributed to our Key Question 7 consultation work or our focus groups, or you may have been at the recent conference where I did a little bit of an input on some of the stuff that we've been doing around the Key Question 7 documents. For those who I haven't met, my name's Anthony O'Malley. I'm currently the Senior Methodology Advisor at the Care Inspectorate. The methodology team is responsible for the development of the Care Inspectorate's approaches to scrutiny and assurance, and that includes our inspection processes and our quality frameworks. We recognise that as a regulator, we're also on a kind of improvement journey to developing our approaches to scrutiny, not just scrutiny and inspection, but also how we support improvement. The review of Key Question 7 was a key element of the methodology team's work over the last 12 months, and I'm going to share some highlights now of the consultation findings, followed by what we've done with some of those views of the people who were contributing to that work. So in terms of the consultation itself, it took place roughly over the summer of 2023, which I appreciate is was not always an ideal time for a sector such as yourselves in relation to work patterns and stuff, but grateful that people were still able to come to some of the focus groups and contribute electronically to surveys and stuff with that, and we were kind of bound by resources available at key times for ourselves as to when we could hold those things. So we started with an electronic survey across the CYP sector, and we also had one for inspectors. We had did some in-person work with young inspection volunteers and did some virtual work with providers, people working in services, and our inspectors. Our young inspection volunteers, if you're not aware of the kind of work they do, they're really critical to the work of the Care Inspectorate because they keep us really focused on things that are important to children and young people. The Key Question 7 work itself as well was also supplemented by some other consultations and work we were doing around self-evaluation tools. And we have a bit more detail on that, as Charlotte said, as we move through the session this morning. So now looking at the consultation findings, an overarching theme from the consultation work was that Key Question 7 was working well, both for inspectors and providers, and it mostly captured the really important issues for children and young people. There was almost unanimous agreement that Key Question 7 was prioritising children and young people's experiences and the relationships contributing to their care. There were some questions, though, around how that works with processes and how an outcome-based approach to inspection and regulation also incorporates processes, and I'll touch a little bit later on that shortly. A key aim for all of our quality frameworks, though, is that they're easy to stand, they're accessible, and they're outcome focused. And again, in that regard, views that were shared with us during the consultation were almost entirely positive. We heard from some leaders and managers that Key Question 7 was particularly helpful for new staff or people with less experience of regulation or less experience of using a quality framework or contributing to the development and improvement of services, because it's a more concise document, more streamlined, more high level, and not as big as a full framework in terms of being able to digest that without becoming overwhelmed or the time it takes to really explore that. We did hear also that Key Question 7 felt more proportionate, particularly with regards to feedback during the inspection and our reports, and with it being a single key question, there's a logical pattern that makes sense that would be the case. So people were quite comfortable that was the case. But critically, both people working in the sector and inspectors agreed that Key Question 7 was still a robust inspection methodology. Although we had streamlined it, it was still robust and still letting us cover the really important aspects of children and young people's care. We did hear, though, that some of the quality illustrations would benefit from review, and I'll touch on that in a wee second as well. In terms of what could be improved, one of the key subjects that was mentioned, and this came up in a number of responses and during focus groups, was why we still looked at some processes during inspection when the focus was on outcomes. Mary will talk a little bit more about this when she's discussing some of what's changed in Key Question 7 document for the mainstream boarding school and school hostel sector. But we've responded to this request, or this kind of ask from the consultation, by including details of the core assurances within the updated Key Question 7. Now, the core assurances are a corporate thing that the care inspector has across all inspections of all regulated services. And those are the things, the core assurances are the things that inspectors will look at in the course of every inspection. They're often what people consider to be the process or the paperwork part of an inspection. So there's more detail and more context in the new document on what those core assurances are. We do take a proportionate approach to them, and they vary slightly from sector to sector type. Some apply to some sectors, some don't, but they're an overarching thing across the care inspectorate. We also heard that some of our quality illustrations could be updated to better reflect the experience of children, young people, staff and leaders. Mary's presentation will take us through that in a bit more detail. On the whole, though, the changes requested or asked for mainstream boarding schools and school hostels were relatively small, and we'll touch on them in more detail, as I said, later on this morning. But they aren't necessarily big wholesale changes. They're quite small and focused. As I mentioned earlier, though, some people told us that, Key Question 7 was quite useful as a document for streamlining things for staff, given that high-level strategic overview of what very good looks like. But we are aware that, from what people told us and from our own work across different sector types with self-evaluation, that the full framework document, which is still there, still a live, active document for services, that can be more useful for self-evaluation. But in addition to the Key Question 7 work, we did have some overlap with looking at self-evaluation in CIP in different sectors and how we do that. And as part of the Key Question 7 review, we've decided to incorporate the development of self-evaluation toolkits, bring them into one, essentially, so that we're publishing both at the same time. So this is updated framework, but also increased improvement resources. So in terms of what this actually means for the Key Question 7 document, as I say, Mary will touch on what the updated document looks like, and they'll be in use from the 1st of April 2024. They've been published now to let people familiarise themselves with the document. The new document looks kind of more like a full framework. It has much more context about our approach to inspection, evaluations, and the core assurances are included for the first time. So, to support this, though, we've also developed and released improvement resources for the sector. On the right-hand side of this slide, if you can see it, you'll see a screenshot from the landing page on the Care Inspector Hub. We'll pop a link to this in the chat as well, and we'll also email it out after the meeting, and it'll be in provider update for your services this week as well, just to really highlight that for people that it is now there. We've added a virtual improvement toolbox. That's shown by the black arrow on the right-hand side of the screen. If you can see the two quality indicators that are mentioned there, they each have a small cross icon. clicking that brings up a drop-down list of links and different improvement resources for us to help signpost you to improvement. Previously, that sort of stuff would be contained in a framework document, but of course that goes out of date and we don't update the frameworks periodically. You know, it takes a bit of time before our framework's updated. With the virtual improvement toolboxes, the methodology team will periodically check and update those links. So it just keeps it more live. And you can also access these from a link in the KQ7 document itself. If you can see the purple icon, the purple arrow, you'll see that that's where the link to the self-evaluation toolkits are. These are available on the hub page as well, and I will explain a little bit more, explain about them, sorry, in a little bit more detail after we've heard from Mary this morning. So I'm going to hand over to Mary now, who's going to take us through some of the changes to Key Question 7.
Thanks, Anthony, and thank you, everybody. It's really great to see so many people joining us this morning, and we're very grateful for Kirsten and the team from SCIS for circulating information about this session. And we're looking forward to having further sessions over the course of the next few months, year, and build on that approach that we've taken. So if we move on to the next slide. Thanks, Anthony. So I'm going to be fairly brief this morning. I'm not proposing to go into huge amounts of detail with you. I think it's probably helpful for folk to have a good look at the documents themselves. But I'm going to talk a little bit more, as Anthony said, core assurances and why some of the infrastructure, the processes, the paperwork, if you like, why it's important and how it fits in with our evaluations. Hopefully give you some reassurance that our approach to inspection, it's not really changing. And just highlight some of the, as Anthony said, relatively small changes, but hopefully helpful changes, and being more explicit with you as to what constitutes, a really well-performing service. So I'll start with the core assurances. Okay, so core assurances as a term is relatively kind of new. I think the last few years the Care Inspectorate's used it, but actually it's kind of not new in terms of key inputs and processes. But what we're doing in response to kind of what feedback from yourselves and other folk is being more explicit about it, and so that you can be as prepared for inspection as possible, and understand a little bit more why we need these core assurances. It's not because we want to give you extra work. It's not because we're desperate to spend a lot of time looking at paperwork. But what we do know from research, from inquiries, very likely, from the current child abuse inquiry, which I know people here are very interested in and have contributed towards. We do know that you need to have some key infrastructures and systems in place. So while we're looking at outcomes for children and young people in your services, so we think about child protection, we think about safety. Of course, everybody absolutely wants children to be safe. And if we're on inspection and that's what we're told, that's what young people are telling us, that's what staff are telling us, that's great. But we also want to know and be assured that that's not by accident, that's part of a result of sustained and well-designed systems around child protection to ensure that that's the case. So that's why we need to know that there's a child protection policy and procedure, that staff and leaders are confident, they know what to do if they're faced with an issue, And we will be checking that out during the course of the inspection. And if we feel that could be enhanced, we'll be saying that to you, and we will kind of take that into account in terms of our overall evaluation. So our evaluations are definitely based on outcomes, and that's what we're spending more time talking to people, to children and young people. Of course, we want to hear about all the fantastic achievements and work that's going on in your service, but we also do need to know that in the event of something happening, and we're in a world, particularly around child protection, aren't we, where there's new things, new risks. We've got social media, and that's, I think, brought a lot of different things into that area that certainly 10 years ago we wouldn't have been having to deal with and respond to. So we need to ensure that that we can go away from a service knowing that young people are safe, and that the infrastructure and systems and knowledge and understanding is going to keep them safe in the future. So I've touched on child protection, but you can have a look and see that there's other core protections. We've got infection prevention and control, and my goodness, we saw how important that was, during the pandemic. But as I say, I won't go into all the detail around that, but that hopefully explains a little bit about why we need to have both. We need to have what's actually happening when we're there, but we also need that assurance. So if we could move on, Anthony. So I'll pick out some of the key changes in the quality, in the key question 7. The key bit here is around personal plans, and I know this is something when we've met with you, you're always interested in, and we've tried to be more explicit really here about personal plans. So what we're looking for is that personal plans aren't static, that they're dynamic, and they reflect children and young people's evolving needs. So it may well be that you've got children and young people, as I know you will have, who are pretty settled, doing well, not huge amounts of change. Their home situation's stable, and as I say, they're doing really well in your service. So you don't need to have that much detail for those sorts of young people. But we do know that, young people, you can have somebody at 11 or 12 who's, as I said, very settled, doing really well. But perhaps by 14, there might be some things that are changing for that young person. Their needs are changing. There may be things in their home life that are about for that young person. And when we speak with staff, usually staff, are pretty well sighted on what's going on, but sometimes the personal plans haven't been updated to reflect, something going on at home. There could be something going on with health. I mean, it could be that a young person's doing incredibly well, but perhaps is under considerable pressure, and that you're kind of thinking of ways to support them around those sorts of issues. But we are looking that the personal plans reflect the understanding and the approach that's happening with a young person. In many ways, it's kind of a bit like showing your workings out. If you've, I wasn't great at maths at school, but I know that I maybe wouldn't always arrive at the right answer. But if I could show that I was vaguely on track, and that I was, I had an understanding of what was being asked. But it's just important that that where there are changing needs, that is reflected in the documentation. So that's why that one's in, and I think that that, you know, that has been something that you guys have kind of asked about a lot. So hopefully that's clearer. If we move on to the next one, Anthony. So this is just around staffing, of course, absolutely essential. So it's around that there's that there are the right number of staff who have skills and experience available to care for children and young people. So it's just around ensuring that you make sure, again, it's linked to your understanding what children's needs are, but if there's things going down, you may well need to deploy more staff at certain times. And we know that young people and really value their relationships with staff, and if they're, you know, if there's anything that's worrying them or pleasing them, it's always important that there are enough staff to be able to respond and support young people. So again, just being slightly more explicit around that. But that's not new. That's something you guys have been working with for a long time. And then there's another one. Yeah. And again, just thinking about safety and what I was speaking about earlier, just being a little bit more explicit so that risk is well understood and managed effectively. Not for its own sake, but to help keep children and young people in your services safe. So if there are issues, if there are concerns that young people are involved in things that could potentially be placing them at risk, if you're concerned about young people's, perhaps their mental health, perhaps their mood has dipped, or, you know, somebody who's been doing really, really well starts to disengage, or, you know, whatever the issues are, that you're, you know, aware of them and you're responding effectively and anticipating to keep children and young people safe. And we see this done really well in most services. You know, I can think of an example where a young person you know, started to have kind of issues about meal times, and seemed to have issues around joining the group and eating, and staff picked up on that really quickly and sensitively, and, you know, responded in a supportive way. So it didn't turn into a much bigger problem, and that's, you know, it's not uncommon, particularly with teenage girls. There might be kind of issues around image and body image and that sort of thing. So it's just about you knowing what the risks are for your children and young people, whether it's within the school, whether it's external, whether it's whatever the issues are, but you're understanding them, you're anticipating them, and, you know, you're making sure that you're putting measures in place to minimize those risks and optimize those really good outcomes for children and young people. I think those are the main ones, aren't they, Anthony? That was the ones we picked out. As I say, there's not huge changes in this one. In our slightly different KQ7 for children and young people. So for the other services that we scrutinise and inspect, there's a bit more in terms of the national picture on the promise and some of the key drivers in that. And while that is, you know, aspects of that are relevant, we know that that's for looked after children in the care system. So there wasn't the need to be quite as explicit in terms of that national driver for the promise. But hopefully that's just given you a wee kind of taste of the changes, which aren't huge. We're not looking to change how we inspect by a large. We think it works well. We're able to, we've had really good engagement and support when we've been out in your services. You're always really helpful. And we hope we can build on that going forward.
Yeah, thanks, Mary. I just to touch on Mary's point there as well, I think with the mainstream boarding school and school hostels, key question 7, the changes are very much almost all about what people said during the consultation that they needed a bit more clarity on, or where inspectors felt clarity would be helpful, in terms of what they're seeing on inspection, where people maybe need a bit more guidance. So that's predominantly the kind of driver for the changes in this document, rather than being any kind of policy driver behind it. So I will now take us through some of the self-evaluation toolkits, folks, which I hope will be helpful for you, because this is a new thing for the sector as well. And then we'll have a little bit of a short input from Lauren, one of our inspectors, just a brief opportunity for people to get involved with us in another bit of work. But I'll take us through some of the toolkit stuff at the moment and around self-evaluation. So as I mentioned in my earlier presentation, we've now published self-evaluation toolkits, which correspond to each of the full frameworks that has a corresponding key question 7. So mainstream boarding schools and school hostels will have a toolkit, care homes for children, young people and special residential schools will have a toolkit, and secure accommodation will have a toolkit, and they're unique to the service type. Very similar in some ways, but tweaked so that they're most relevant to your service type. So before I talk through what those documents look like, I'll give some background on self-evaluation, which is something that the Care Inspectorate has committed to supporting and embedding and supporting services to embed as part of both our scrutiny and assurance strategy and our corporate plan. So what is self-evaluation? So the really key thing to remember is that most services will already be doing some form of self-evaluation, sometimes without realising it, but there'll be lots of quality assurance and monitoring and stuff going on in services. And we look at self-evaluation as a continuous process that's aimed at developing and improving services. It would usually involve bringing together your various quality assurance processes, monitoring, the kind of things I've spoken about there, to look at what's working well and what could be improved. It doesn't tend to work to its full potential if it's treated as a one-off event and not revisited. So it's a continuous process that you would revisit, although you may have one-off events or one-off bits of evidence gathering that contribute to it. The self-evaluation process itself is continuous. It's also a way to inform your improvement or development plan. So, things like building up your evidence base, thinking about what you want to improve and developing your service, who can do that, how long will it take. The evidence gathered from your self-evaluation is a way to inform that, your improvement and development plan. A really crucial thing to emphasise, and I'll probably emphasise this more than once this morning, is that it's not done solely for the benefit of the regulator, but it's rather for the people, or in this case, children and young people who are using the service, by driving improvements in the quality of their care. Although, Mary mentioned the core assurances this morning. One of our core assurances that we look for at every inspection is an improvement and development plan. So we do look at that during inspection, but the self-evaluation process itself should be for the benefit of the service and not purely for the benefit of the regulator. We are going to be undertaking some tests in some of our adult care services where we'll report on the quality of services self-evaluations in the key messages section of our report, and that's more about where we've been offering self-evaluation toolkits to sectors at different times, and when was the right time to introduce them for each sector. And as I've said, I think we've come to the realisation that now is the ideal time to bring these toolkits for yourselves and for the services you work in. So we recognise that people are at different stages in that journey. So at the moment, we're only testing that in adults, and that's much more about us identifying whether our work to help embed self-evaluation in services is having an impact. But for this, we know that different sectors are at different points in that journey with us, and this is relatively new for mainstream boarding schools and school hostels in terms of us making toolkits available. So within the new Key Question 7 documents and within the full frameworks, you'll see that we discussed the model for improvement. This is the model that our self-evaluation toolkits are built around, and it's based around 3 questions. So first is the how are we doing question. That's where you can consider how to measure performance. Now the toolkit, and I'll come on to this in a wee minute to show you an example, but the toolkit suggests using a 6-point grading scale, but you can use whatever works for your service, you know, and it really is some people use smiley faces, some people use stars, some people use thumbs up. It's just about saying, well, how are we doing? Where are we just now? We need to have a measure so that we know whether we've made progress or whether we've made improvements when we get through the rest of the self-evaluation process. The second question is how do we know, which is about gathering your evidence. So again, I won't go into lots of detail this morning. I'll do a little bit more on this, but the toolkit has all the information you need. But the main thing to consider when you're looking at the how do we know question is lots of sources of evidence and how everyone can be involved. And that's, you know, children and young people, relatives, your staff team, leaders within the service, other stakeholders and professionals you're working with. You can do some peer work on that. Just about maximising the sources of evidence and maximising the involvement of people, really. The final question is what are we going to do now? And this is where your improvement or development plan comes in. So when you've answered the first two questions, you will likely have identified some areas for improvement, potentially some quite small, they might be quite big. It really depends on your service and what you're looking at. And you can then use them to create your improvement or development plan, which will help you identify the various tasks and you know who will be involved to help deliver your planned improvements, if you like. So in terms of the how are we doing question, this is just an example on the screen, you know, it's kind of similar to how it looks in the toolkit and in some of the templates we've provided within the toolkit. And I will give you a wee breakdown shortly of what's actually in the toolkit. But one of the things here is, you know, we have the 6-point grading scale, as I'd said, and here we've looked at a key area, that the key area being children and young people are kept safe and protected from harm. And, you know, if you were saying, well, that's good, and we use a grading criteria of good, which is about there being important strengths with some areas for improvement. So our evaluation of good, as you can see on the screen, is, and this is consistent through our grading criteria, and you'll see this is linked to within KQ7 as well. Talks about there have been, you know, a number of important strengths, clearly outweighing the areas for improvement when you bring them together. The strengths will have a real positive impact on people's experiences and outcomes, but we know that improvements are required to maximise well-being and ensure that people will consistently have experiences and outcomes that are positive or as positive as possible. Now, when you start doing that, you might think, yeah, we're good, but actually as you gather evidence, you may go, oh, actually, no, looking at our evidence, we're probably very good, or you may go back the way, or you may start at a higher point and move back. So this question can be fluid throughout, and this is the one you would keep going back to in terms of measuring progress, like I had said. In terms of that how do we know question, like I'd said, that's about your evidence gathering, and this is a diagram that's taken directly from the toolkit. And in the blue circle, you can see, you know, this is your self-evaluation of a key area or key areas, depending on what you're doing, and everything that then feeds into that. So that's your quality assurance activities, for example, audits, or you may have an appraisal system for staff, or you may have environmental checks that you do routinely, and, you know, you're involving all the people who are involved in that aspect of the work. So really broad, you know, involvement of people there. You may also have participation stuff. So questionnaires are the obvious one that people tend to go to as an evidence gathering base. You'll see the care inspector, we use them for this very project, but we do use other things as well. And it's just about that participation and involvement. And there's lots of ways that people can do that. For children and young people's services, you know, it can be quite different from what it looks like in perhaps an adult service, or an early years service is going to be different again, because it's different, you know, people's needs are very much different. So it's just what works and how you can get that evidence. We also suggest benchmarking, so it could be from the quality framework, and as I said, the full framework gives you much more detail in terms of quality illustrations for key areas that are more detailed than Key Question 7, which is that high level view. But you can also use the health and social care standards or any other best practice or good practice documents that your service is using. So it's just thinking about a benchmark and what does that evidence tell us that's out there in terms of literature as well. And when you've done all that, that's then going to inform your what are we going to do next, because that's where you'll have identified your areas for improvement. One of the questions, though, that people often ask is with self-evaluation is, well, where do we start? You know, if it's new to us, or if it's somebody who's new to self-evaluation, or it's a different approach for our service, where do we start? Mary's touched on the core assurances that are we've been we're now including them in KQ7 and all of our quality frameworks for other service types. We do now do that because we're recognising and responding to that ask from the sector for that bit more transparency, but also getting, making things a bit clearer in terms of what we'll do at inspection so that people are better prepared and can have sometimes a better dialogue with the inspector. What we suggest doing if people are finding it challenging is you can always start with the core assurances, because like we said, they cover lots of aspects, lots of the important aspects of children and young people's care, and starting with the core assurances is one way of doing that, because it makes help you identify which areas of your practice are strongest compared to others. And you'll see within the toolkits, this is just a little screen grab of one of the tools that's in the toolkit, which is the core assurance tool, and it's got all the core assurance listed, which are the same as they are in KQ7, and you can then add your evidence to that and start to plan some improvements within that as well. So finally, onto the toolkits themselves. As I said, there's a separate toolkit for each of the corresponding full framework documents that have a KQ7. We'll pop a link to that in the chat, and we'll also email all of this resources out after the session, as well as a link to the recording of today's session for anyone who wasn't able to make it, or if you want to revisit some of it. Within each of the toolkits, there is a guidance document. So that's the kind of one you can see on the right-hand side. That's got the kind of standard cover for a provider facing guidance document that the Care Inspectorate produces. That document will explain the self-evaluation process, probably in a much better and actually probably more concise way than I just did. But it also provides some practice examples, things to think about, and some hints, tips, and links to other resources just to help you with developing your self-evaluation process. We've also provided, though, some worked examples. One of those is a completed self-evaluation tool, which takes you right through from the kind of identifying the area you want to look at, the evidence gathering and analysis, right through to creating and implementing your development or improvement plan. Now, it's purposely generic. It's not designed or intended as something that can be directly lifted. It's intended really as a point of reference to just show you some of the practical applications of different self-evaluation methods and what that might mean and how that can inform your improvement. We've also, as I said, included a core assurance template to support services to self-evaluate against these, and that also includes an example of self-evaluation against one particular core assurance, so showing you with a kind of example within the tool of how that tool can be used. And like I said, the core assurances can be a good starting point because they cover lots of those aspects of people's care if self-evaluation is new to a certain staff member or a team, or you want to just change your approach. There are also blank templates for the self-evaluation tool, for questionnaires, for a standalone improvement plan. But again, I would say these are for inspiration more than being directly suited to every service. We recognise that each sector is unique. The mainstream boarding school and school hostels sector is unique, and we're really thinking about services and how we can continue to support services. So part of that is thinking, children and young people's participation is a huge thing. How can we involve children and young people as well as possible? But again, often services are better at that aspect because you know your children and young people and you know what works well within the layout of your day and your week. And we also recognise that many services will have processes that work well and will have processes in place. So we're not saying, this is the way to do it. It's one way to do it, but it might not work for every service. And I suppose my closing note there would be just to reiterate that the use of these self-evaluation tools is not mandatory. Many services, like I say, will have processes that work for self-evaluation, for planning development activity. These are just some additional support and resources for some inspiration or support, or to help people if you find yourself a bit stuck and you want to move the process along. They can hopefully give you that little boost that you need. I'm just about to wrap up my presentation, and we'll open and we'll hear briefly from Lauren, and then we'll open the chat's available if you want to pop any questions and answers in there. We can try and pick them up depending on who's best placed to do so. And we will also be popping a link in the chat to a survey about this morning's webinar, so we'd encourage you to answer that. And if you do have any queries after the session or burning questions that you forget to ask, or you just want a bit more clarity on something at a later point, we'll also put a slide up with the methodology team's contact details. And if it's not for methodology, we can always pass it to the relevant team manager or case holding inspector. So I'm just going to hand you over to Lauren now, just before we start the questions and answers. But please do think about what you'd like to pop in the chat if you have some questions for us.
Morning, everybody. My name's Lauren Cameron. I'm an inspector with the Care Inspectorate and also part of the school care accommodation team inspections also. So the reason for me wanting to speak to you today was about a project which I'm running at the minute. And the basis of the project is looking for more participation from young people whilst we're on inspection. So what we were hoping to do is reach out to you and see if you had any young people that you think would want to be involved in the project, to get in touch with us. So what we're looking for is groups of young people, and it's about hearing their views, so that we could put together a small video which would be sent out prior to inspection to raise awareness to young people about what our role is and what we're looking for in inspection and what really matters to them. And hopefully if they wanted to, they could also be part of making the video. However, the most important bit is obviously just hearing their views and what would be really important to them to go out in that video to raise awareness. We have got a video at the moment for the children and young people services. However, we want to make something more bespoke for this area of inspection, as we know that it's an area that we really want to reach out to young people and hear their views and recognise it's different to the other services that we inspect also. So if anybody would like any more information or has any questions they want to ask about it, or have young people that they think would be really interested in being involved in such a project, then it would be great to just pop your email in the chat and we can email. I'll hopefully be emailing out after the Easter, because I realise that the Easter break's coming up, so I would be emailing out after Easter to get names of people that would be involved, and there'd be a consent form that would need to be completed. We have got some views already from some schools, but we want to broaden that so that we had a wider range of views from young people, so that we get the video right, and that it really reflects the views of the young people as well. So thanks for taking the time to listen to that, and please, if you do have any young people that may be interested, even if it's just for even a little bit of their views, or if they'd rather put it in writing, then feel free to get in touch and just pop your details in the chat, and I'll get in touch with you.
Thanks, Lauren. So there was one question from Philip, which responded to. Does anybody else have any questions in the chat? Anything you wanted us to elaborate on? I know it's a Monday morning and people are probably, I think end of term is imminent and probably lots going on. Thank you, Mrs. Bruce Fettis. Oh, any more questions at all? As I said, you'll want to have a good look through it yourself, and this will be, one of, we hope, a number of sessions. And as I said, we've been really grateful to SCIS for allowing us to come along to events that they've helpfully organised, and we very much hope that will continue this year. But if there is anything at all, or else, as Charlotte said, it's always nobody ever is unhappy if you finish something a little bit earlier. but I know when things go over, particularly if they go over to lunchtime, that can be not such a great experience. Thanks, Jill. Okay, I'll take it that that there's no further questions. As I say, if you think of things afterwards, you can always get in contact with us. Thanks, Philip. That's good. We hope it's helpful. As I say, it's not you know, an extensive tour through. It's really just sort of a taster, and just to highlight some of the wee changes that have been made. Thanks, Jane. Okay, Tracy's put the wee survey in the chat as well. We'd be really appreciative if you get a chance to do that. Okay, Charlotte, did you want to say anything else, or do you think maybe folk
Yeah, just to say thanks to everyone for joining us this morning. As Mary said, hopefully you found it helpful. And people who weren't able to join us are able to catch up by watching the recording. We've got all the documents online, so you can go away and have a look at them, and obviously get in touch if you do have any queries, or you know, we can arrange kind of follow-up discussions. And yeah, well, if you're able to fill in that feedback form as well, it's helpful for us to think about kind of future sessions and how useful they are. So yeah, just to say thanks to Mary and Anthony and Lauren for their input in the session this morning, and I hope you all make use of the rest of the time that we're giving you back this morning.